Thank you for joining us for this Denver 7 Town Hall discussion as we all try to get through this coronavirus pandemic together. I'm Ann Trujillo, and we know this is a stressful time. We know many of you are struggling right now. What do we do with all of these emotions, anger, frustration, sadness, feelings of loneliness, hopelessness? And how do we push through those feelings and get to the other side? Well, Contact7 has collected questions today. We've invited mental health professionals here to talk through these issues with us. So joining me tonight, Tanya Sorrell, a psychiatric nurse practitioner and associate professor at the University of Colorado, Brooke Greasy, a licensed clinical psychologist from Judy's House, and Rick Padilla, a suicide prevention administrator with the Denver Department of Public Health and Environment. So thank you, the three of you, for joining in this discussion today. We really appreciate you being here. And I think first and foremost, we're not crazy for feeling these emotions, are we? Because sometimes we go through them all in the same day. I don't know who wants to start commenting on that, but that's, I think, what a lot of people are feeling right now.
Well, no, you're not crazy. This is a change. This is different than what we've experienced before. And it's actually natural to have some anxiety, some worry, and just kind of wondering what's going to happen next. So working on what you can control versus some of the things that are outside of our control is going to be really important right now.
So what can we control right now? Because I think that really is the bottom line issue for people.
Mm-hmm. We can control how we react to the situation that we're in. We can't control the progression of the virus, but we can control the way that we deal with those feelings of anxiety, stress, sadness, loss that are coming up for us with healthy coping skills and with helping our children and family members also cope with that.
All right, I want to get to some of the questions that we've received from viewers. So here's one of them that says, I feel like I need to stay informed, but watching the news is contributing to my anxiety. So do you have any advice for finding balance? And on top of that, how can you find that balance if you're then spending a lot of time online? Brooke, do you want to take that? Or Tanya, go ahead.
It is going to be important to keep balance. One of the first things that you want to do is actually keep the schedule that you've been on before. So if you were working, go ahead and get up at the same time, take a shower, change clothes, but look at arranging your day so that you have that consistency. Then maybe pick one news item that you want to follow so that you can keep up with the news but not get overwhelmed by it. Also look at comedy, other activities, family time, and then use that time to build the connections with your family that not only will help keep you grounded, but will help your family that's also going through these same changes as well.
Brooke, do you want to add to that?
I think absolutely. Tanya's so right. Eating well, nutritious food, making sure we don't have devices at the table, getting enough sleep, 8 hours at least for adults, much more than that for kids. I think so essential right now is exercising and moving our bodies, getting outdoors and experiencing nature. We are all hunched over devices right now. And so our bodies are feeling that stress. Our kids who are in online school are feeling that as well. So really opening up and breathing, connecting with others through whether it's through text and video communication, through the phone, finding ways to enjoy life and do things that bring joy to us are so important during this time.
I know you mentioned sleep, which is a great thing, but even I admit I've not been sleeping well, and I hear that from a lot of people. What do you suggest about that?
I think a lot of people are struggling with sleep right now. I think a really important thing for us to do is sleep hygiene. Really having a routine and a schedule before we go to sleep, putting away devices, putting away the news. As Tanya said, find a time of day, maybe once or twice, where you're checking in on stories with a trusted news source like Denver 7, but putting it away, turning off your notifications otherwise when you're trying to focus, and especially when you're trying to get to sleep. Some of the stories we're hearing, we can only take it in doses. Kids especially can only take in small amounts of information at a time, but we need to be able to take that out of our minds while we're trying to sleep. Do some of those relaxation, a hot shower, whatever it is that helps you relax, watching a funny television show or something that does get you into that space of being ready to sleep.
Okay, one viewer is wondering how she can help her sister who lives in a different part of the country. Have a listen. All right, I will read it to you. It says, I have a sister who lives in North Carolina. She's from Colorado, but moved out there a few years ago and lives in a small area, and they don't have state healthcare programs like we have set up in Colorado. How do we help her? How do we help someone long distance?
You know, this COVID incident has actually helped to recognize the importance of telemedicine and telepsych services. No matter where you are in the country, you can reach out and find help and find someone to be able to talk with, to get services, to get medication, counseling, even support groups. Those are all available now in these types of technologies such as Zoom. They've worked really hard to work on confidentiality so that only the people that are supposed to be in the room are right there, so you can feel that you can trust the people that you're working with, especially to discuss these emotions that can be overwhelming at times. But all different areas now have telemedicine services, telepsych services, telecounseling online, are also now telecounseling through chat. There are also a number of apps on your cell phone that you can use while you're waiting to reach out or waiting for an appointment that can help you with coping skills, relaxation, helping to decrease negative thoughts, and helping with sleep hygiene as well. So telemed right now is really available and willing and certainly able to help even in the far outreaches that she's in.
It feels so impersonal, though, is it not? I mean, is that some of the reasons why people have not gone to that telemedicine?
For younger crowds, it actually has been working better. They're used to FaceTime, they're used to chat. And what we notice is when you're engaging with someone, talking with them, helping to see how they're doing, that emotion and that care and empathy comes across even through
Yeah.
telemedicine. Some patients that have anxiety sometimes tell me it actually is a little bit easier because you've got a little bit of a distance from the other person. So you can really wait to develop that rapport before you then disclose things that might be a little more personal.
Since we've jumped to telemedicine, let's talk about some of the symptoms that we need to be watching for. I mean, Rick, I'm going to ask you to jump in here. When do you know that you need help? When do you know that you need to seek help?
Well, and I think it's really important for us to understand that our brain is as important to our health as our heart, lungs, and bones. And what we're talking about here is our well-being. And how our mind experiences life has a direct impact on our well-being. So when we get out of balance and our anxiety level rises, our stress levels rises, I think we have to understand that those are our well-being off. And I think what Brooke and Tanya have talked about in terms of exercise, enough sleep, proper diet will put us back in balance. So you have to start to recognize when we're starting to feel off balance.
Hmm. How do people deal right now with, let's say, the passing of someone, dealing with death right now? And I mean, I think we all know someone by now who has been touched by coronavirus in some way, not necessarily a death, but how do we deal with those emotions and those fears?
I think I'm sorry, Brooke.
No, you go ahead.
Go ahead, Rick.
Well, I just think traumatic events can trigger a negative response. We have to understand that whether that's a direct traumatic events in our lives or somebody that we care about, that it's gonna generate that negative response, and we have to understand that is a natural occurrence. And then how do we cope with that? If it is seeking counseling, talking to a trusted person, but talking about it really helps.
I agree, Rick. So, and right now we're challenged. Judy's House is a center for grieving children and families, where our main modality is bringing children and families into a setting where they can connect with other people their age who are also experiencing a death of a loved one. And to not be able to gather when we're grieving makes this exceptionally hard time to be grieving and to be losing loved ones. Many people aren't able to be saying goodbye to people who are ill or who are dying, whether it's from COVID-19 or other causes, and that's creating a lot of additional stress and strain on families. It's also requiring that we, as members of the community and people who care about those who are grieving, that we get even more creative about how we offer our support. Fortunately, many are finding ways to commemorate and memorialize people who have died on online platforms, and people are contributing stories and photos to that. But just reaching out, calling, don't let people feel alone with grief. It's very isolating already to be grieving, and we're such an avoidant society of death and grief that people tend not to want to talk about it. Fortunately, people are more aware right now and being more compassionate and reaching out. So if you know someone who is struggling, do reach out to them, give them a call, and connect with them and let them know you're there for them and you're there to help in any way you can.
All right, one woman wrote to us to ask about the stay-at-home order, and she writes to us, the trouble I'm having is dealing with all the disappointment of having nothing to look forward to. I'm going for walks, getting exercise, but I often find myself covering my emotions up too much with baking and doing other things. What advice do you have for someone like that who feels they have nothing to look forward to?
Well, actually, this is a time when you can really look for and reconnect with some of the most important things when our busy lives take over, we might tend to neglect. There might be uncles that you haven't talked with in a while, family that you may not have connected with or might have been estranged from, that now you want to reach out because of this trauma and the uncertainty of what's happening. And then in the meantime, little by little, add those activities that are meaningful for you. You can go for walks, just making sure you have your mask on and maintaining actually it should be more distance, socializing from a distance rather than the distance, because otherwise that distance is another disconnect for us. Mm-hmm. Maintain that distance and then go for walks. Take some time out with a pet. And then do the things that you might enjoy. If you're with your family, this is a great time now to say, hey guys, let's sit down and play a game. Let's connect. Let's sit down all together for dinner.
But what about those people who are alone right now and feeling isolated? I mean, we're hearing a lot about, our senior care centers where they can't have any visitors, and those are our most vulnerable. And it just seems like that's a high risk area right now on so many different levels.
Mm-hmm. And it's also the older population is not as familiar with technology. I think so many of us kids and we adults that have managed to figure out how to stay connected via technology, the older adults in our lives need help with that. I know that I had to help my dad learn how to do Zoom so we could have our family Zoom meeting. It's critical that people who know older people who are alone and who are feeling isolated, reach out to them and ask them how they can help them walk them through learning how to use their smartphone to connect visually with someone if that is something that's important for them. Sending them books to read, sending them crafts or photo albums, pieces of their life that they are missing, and that connection to people who love them. It's just so critical that they know that, and that they do, as Tanya said, have hope for the future and have things to look forward to.
And let's talk about those people who are at home. Let's say you can't work right now, you're home with your children, there's stress on your marriage, there's stress on your finances, you're trying to teach your kids and that's not your strength. How do you deal with all of that?
The first thing I think we all did is take a deep breath. Yes. It's going to be okay to take some time to say, how do I structure kids' day so that their day also has a schedule that's similar to school? Hmm. When everybody takes a break, okay, this is our recess time, we're going to go for a walk. And then you do that together. That's another connection. Also recognizing that you might need a little bit of space in the house. So find a safe space for yourself within your own house so that after school, you can have some downtime. The kids can have some downtime to collect. Also recognizing during times like this, there might be stress in the way of domestic violence or child abuse. So you want to make sure that if you're having struggles with that you reach out for counseling and support as well. Sheridan Health Services offers an integrated care where we work on the physical and the mental and dental to work all together in working to help clients to do better and feel better. reaching out for those types of services can help you to be able to function, to learn how to manage, and not to let it be overwhelming.
And let's talk about some of the emotions that we're seeing. As people talk about wanting to get back to work or gradually getting back to work. I mean, we're seeing, the protests in Michigan where there's some anger and there's some angst about they want to go back to work and let us go back to work now. And there are some, I don't want to say people are being mean to one another, but I think that there are some of those emotions as well. How do you manage those people and how do you manage those kinds of feelings?
Ann, I would just add to the previous question. It comes to me about stress, and I think it's important that we understand that, certainly in the worry we doesn't mean we have poor mental health. It means that those things are affecting our mental health, and we need to talk about it. We ought not let it define our lives. It's just affecting our mental health, and there's a great need to talk about it, whether it's amongst friends, family, or clinicians. But there's a great need to talk about that, to work through those stressors.
And that was a problem even before this issue.
Right.
So now there really are more than one grief. There's the grief of maybe losing a job, the kids not being in school. There's also the grief of our fear about COVID. So there are a number of things that people may be grieving about. And when we look at the stages of grief, all the issues that you mentioned, anger, denial, bargaining, depression, all of those things are happening with many of us all at this time. So recognizing and having some compassion, realizing that everyone else is going through this all together. And there might be a mix of feelings from time to time that might change without any type of notice. And then say, hey, how can we manage this? How can we work together? And then also to be able to reach out and connect, which is something we also had difficulty doing before, so that we can understand, okay, they're angry, but I'm going to understand that they're going through something right now. They may be at a different stage than I am. I might be at acceptance. And so then I'm going to be able to recognize and understand how they're feeling and try at least to understand or reach out and recognize that it's not about me. It's their external response to what's happening with them and not feeling like they have the control.
Not take it personally.
Exactly.
We have a viewer who says, my son has Asperger's and he has social anxiety before about staying home. How do I plan and help him when we do go back outside and back to school?
That's such a great question. And it's interesting to look at kids who are introverted or who prefer to not be in social settings and those who are missing it tremendously. And I think it's a different experience for each of those types of kids. And for kids who have struggled with anxiety in the past, I had one very wise 11-year-old say to me, life is just one big exposure therapy session right now. Everything is raising anxiety, and she's having to really beef up those coping skills and that resilience and really tap into that mantra of we can do hard things. And I think for kids that are going to be or thinking ahead to when I go back and I think that is an important thing for them to remember, that they are developing skills to cope with all kinds of adversity right now. And there's those who need to know that we will go back to a place of normal, of being back to being able to gather. They also, we're going to need to deal with this dependence on devices that we've developed. I think prior to this pandemic, I was very big on limiting the amount of screen time and the amount of connection to devices. I had a big, if I don't have social media, but I would have had hashtag don't be divisive and be less phony, because it was really impacting the mental health of our youth and of adults, quite frankly. We're going to have to learn to unplug again. We need to unplug now and take breaks. But once we go back to not being on online learning and school, we're going to need to be adjusting to that again.
Well, and even for adults, how do you, one viewer asks, I feel better working from home right now. How do I prepare for going back to the office? I feel safer at home.
And I think many will start to want to explore opportunities to work from home. That's something that the workforce is really having to kind of think about. And people, as they think about what is an ideal job for them, they'll have to look at that. If they need to go back to work, then we're going to have to tap into those coping skills to adjust to that new normal, as we've had to do the same for adjusting to this time of very abnormal conditions.
That's right, Brooke. And even analyzing or kind of saying to yourself, what's helping me to cope right now? What resilience building am I have? What coping skills are helping me to stay calm? How can I bring that to my work environment?
Well, and on that coping issue, what about those who have addiction issues and are afraid of relapsing? How do we help those people right now?
Mm-hmm.
One of the things that we've done, I actually oversee 40 different clinics around rural Colorado that work with medication-assisted treatment for opioid use disorder. We've converted much of our therapy activities to telemed so that we can still reach out and provide services, even having virtual groups and support groups and AA groups so that we can continue to help people.
Mm-hmm.
Especially now, there could be a trigger to relapse, and we want to give as much support as possible. We've actually had some clients that may have been using opiates, and now since with trafficking, it's a little bit harder to get access to illicit substances. This may be a time to say, maybe it's time to get off the merry-go-round of substance use and get my life back. You know, this can help you to have some clarity of thought to say, now's the time to get help, and to be able to reach out to us as mental health providers and substance use treatment providers to say, hey, we have time and can work with you even through distance to help you to get your life back together.
A lot of people are trying to keep busy during the stay-at-home order. Help us not feel badly about not being the organized ones and cleaning out our closets and baking, miraculous things.
I can help you feel better.
Some advice, please.
I can help you feel better about that. I think the media and social media are helping us feel connected, but they're also helping us feel worse about ourselves, that people are talking about learning languages and writing books. And we have to let go of this image of perfection, especially right now. We have to give ourselves grace. We have to know this is going to be messy. It is daunting. It is hard. Parenting anytime and living is hard, but with folks who are having to go out onto the front lines, and whether it's medical, essential services, the families who are dealing with that real adversity, and then the families who are dealing with the inconveniences of just feelings of anxiety and stress of being not having that space in their togetherness when they're home. It's okay. It even just developing a new good habit. I loved what Tanya said about eating dinner together. I think one of the things that I hope out of this time is that we'll be better at being families. I know that we play euchre every night to see who does the dishes. Everyone is feeling like they're doing so much cooking and so many dishes. If we can find some ways of doing that better, just as basic.
There is definitely some value in that. And on any day, kindness goes a long way. In a pandemic, kindness can be life-changing. Well, here is Dr. James Rouse with the Human Grace Project sharing just how much power kindness can have. Listen.
Hey, it's Dr. James with the Human Grace Project, and just this morning on my way to the station, I saw a bumper sticker, a blast from the past, random acts of kindness. And I thought to myself, wow, that's so interesting. Kindness is everywhere, ubiquitously so, but we have no idea how powerful it is. It's even become cliche. So here's what I want you to know. Kindness is literally life-changing powerful. Here's what happens when we witness kindness. Number one, you release a chemical called serotonin. That's oftentimes called our happiness hormone. Number two, something called dopamine. Dopamine is all about motivation and confidence. It actually makes us feel more possible. And number three, oxytocin. That's the hug hormone. When you're hugging someone, you actually release oxytocin. It actually helps with blood pressure. It helps with feeling a sense of trust. And that also happens alongside of serotonin and dopamine. So you're thinking to yourself, wow, emotional, physical, and spiritual, all these benefits happening when we do kindness. So what happens when we actually witness kindness? The exact same thing. This is the cool part. So if you're out there thinking to yourself, wow, you know what? I'd love to be more kind, but I'm a little anxious. I'm a little scared to go out there and do something kind. Here's some permission for you. There was a group of highly anxious individuals. They were literally under the care of doctors, but they were encouraged to do one thing, and that was to do 6 good deeds every single week for 1 month. 6 deeds each week. Here's what they found out. After it was over with, this one experiment of doing good deeds, they saw their anxiety decrease, they saw their happiness increase, and their sense of connection with community all across the board went up. Why? Because kindness is contagious. And you look around the world right now, it's one thing that costs us nothing to do, but literally has a currency that's bigger than all of us.
All right, so we wanted to make sure that we ended this conversation on a very positive note. Do good deeds. I think that's a great takeaway. Have dinner together, and yes, we could even do dishes together. So I just want to say thank you to our panelists. You've been terrific, and I know we could talk for hours because there's so much on our plates right now, but you have helped talk some positivity into our lives. Brooke Greasy, Rick Padilla, Tanya Sorrell, thank you all so much for joining us. And thank you at home for watching. We certainly appreciate it. Stay with Denver 7 as we continue to have these town hall discussions about issues that are important to you. I'm Anne Trujillo. Thanks for watching.
Thank you.